Hey, Tony Maritato here. So this is actually my first ever Amazon live stream. What we're doing today is we're talking about the Renpho Blood Pressure Monitor. I got this. If you didn't see my original video, I received this as part of a collaboration with Renpho. I turned 50 years old this year. My blood pressure has been creeping up. My body weight's been creeping up. You can see behind me down there, I've got the Renpho Smart Scale. I am a physical therapist. For those of you who don't know me, I turned 50. I want to make some changes. I need to manage this and I want to do it naturally if I can. So what I'm doing today is the second day of monitoring my blood pressure using the Renpho Blood Pressure Monitor and monitoring my body weight using the Smart Scale. I'm going to take this top layer off. Give me just a second. When you're looking at monitoring blood pressure, it's important that I don't like to have any fabric between my skin and the blood pressure cuff. We should be sitting here for at least 5 minutes, kind of relaxed. Both feet are on the floor. The blood pressure monitor Renpho creates connects to an app that you can have on your telephone. Now, I did not install the app yet. That's what I'm going to hope to do this weekend. I just wanted to get a feel for the blood pressure cuff, understand how it works. It's really small, super compact. You can see it right here. It does run off of 4 AAA batteries. When you push the start button, it turns on, it turns off. This is an adjustable cuff so that it'll fit most adult arm sizes. And what happens is when you're putting the cuff on, you want to make sure that the cable is not tangled, the tube. There's a little insignia here that says ART on the bottom. That's to line up with your artery. It's a Velcro cuff. So I'm going to set it up here on the arm. My artery is lined up. The left arm is best. And so now, I know I haven't been sitting and relaxing. If you guys are coming on, I think I can see the comments on the phone. Ask me any of your questions. I'm going to talk for a minute while my heart rate and blood pressure come down just a little bit, but it's probably around 120, 125. I'm here in my physical therapy clinic. I treated patients this morning. I had a lunch break. I'm about to have my afternoon clients begin. But blood pressure is such an important aspect of what we do. We try to monitor our patients' blood pressure as they're coming in and out of the clinic. And I can tell you truthfully, most of my patients have no idea what their blood pressure is. Some do regular checks, but most don't. And what I see for people in my age demographic, I'm going to say anywhere between 40 and 60, is that we've been healthy most of our life and we're not paying attention to blood pressure. It's not something that's on the radar. But secretly, if it's sitting there rising year after year, even gradually like mine has been, if we don't start making changes now, what happens is all of a sudden you blink an eye, 10 years later, you have to go on medication. You have to make more drastic changes, and the damage of high blood pressure has been done. Even if you get it back under control, if 10 years from now I'm 60, I go on blood pressure medication because I couldn't do it naturally, the damage of the high blood pressure to the arteries has been, it's happened. I can't reverse that. So we want to prevent it more than we want to treat it. We want to prevent it more than we want to deal with it later. And a little blood pressure like cuff like this from Renpho Blood Pressure Monitor, super affordable, easy to use. This is probably one of the best Christmas presents I can think of, because what this does is it says, hey, mom, dad, brother, sister, I want you to be around. I want you to start managing this. So I'm going to hit start. It's going to inflate. I'm going to try to be quiet for just a moment. Bear with me. All right, it's done. So, you know, it's a little discomfort. You feel a little pressure around the upper arm. Nothing terrible, nothing traumatic. I'll show you guys what we got. Proof is in the pudding. So I don't know if it's reversed or not on your side of the screen, but 119/82. Here's the deal. It used to be 120 was considered like good for an upper number, the systolic number. 119 is right there. It's right in place. You know, I haven't had problems with my systolic blood pressure, but my diastolic is way too high. 85 is way too high. The classic number used to be 120/70. They started to reduce some of those numbers. As I research and I look at what would cause my diastolic to be up while my systolic is relatively normal, dehydration is part of it, and I know that I'm chronically dehydrated. Just so you know, this is battery operated. It's got fresh batteries. When I got it, it comes with a set of batteries. It turns off automatically. So the display was lit for I don't know, a minute or so, but then it turns off to conserve battery life. What I'll do is, once the original batteries are dead, I'll get rechargeable batteries that I can use into the future. But back to what I was saying, the diastolic blood pressure, dehydration can cause elevated diastolic blood pressure. Other lifestyle factors and influences can cause problems with diastolic blood pressure. I am on a mission to try and bring both of the numbers down. My heart rate was 66, pretty decent. I do enjoy running as a regular physical activity. I try to run 3-4 days a week, but I want to get that diastolic number down. So guys, if you're an adult living in the US, you're looking for ways to kind of start to measure what is your blood sugar doing? What is your blood pressure doing? What is your body weight doing? The Renpho has all the tools that you need, and I'm not getting paid by Renpho. I use a lot of their products in my physical therapy clinic. I just want you guys to know about it. I appreciate everybody who's here live now. If you have any questions, you can find me on social media across multiple platforms. Otherwise, good luck. Happy holidays. Thanksgiving is right around the corner. I hope you guys do an amazing job, and I will catch you guys on the next live video. Thanks for tuning in.